This is Rick NG, a medical doctor, and he works with a very well-known physician, David Brownstein, who's one of the top guys in alternative medicine. And Rick was here for our oxidation workshop. This is the end of the first day, and I wanted to get your comments on what you think the value of this is.
This is the best clinicians training program I've ever been at. It's a giveaway for everything that I am taking away. The intensity of dedication from these good people who have had 20 plus years of ozone experience, they're giving it all to us. The Prolozone was absolutely phenomenal. I feel very confident in regards to how I'm going to go ahead and administer that on Monday morning. The amount of work put in is very, very evident. A lot of bang for the buck. Everybody should attend it.
Were you surprised at the results you saw?
Very much so. And just the variety of problems that people were presenting with and the resolution and benefits that they had. Absolutely phenomenal.
Was it worth the cost?
Oh, God, I'd double that in a heartbeat.
Wow. Thank you very much.
Oh, please, thank you.
David hasn't been here yet, has he?
He's singing the blues as I called him up and said, hey, you missed a damn good meeting.
Okay. That's very kind of you.
Please.
May I post this on YouTube?
Please do.
Thank you very much. I really appreciate it.
Oh, God.
Today's date's February 8th, 2016. We're back here with Howard Robbins, my Ebola battlefield blood brother, who's very famous around the world for his work in DIV, and he came to our workshop this weekend to teach some DIV, and he thought he knew it all, and I'd like to hear what his comments are about this weekend.
Once again, I have to say, while I came here to train other people, I wound up getting trained. I am always absolutely impressed and sincerely blown away by all the knowledge I walk away from when I come here. I wouldn't have missed this weekend for anything. It was invaluable to my practice. The hyperbaric high-dose ozone therapy, the method that you've developed, that you're refining, is without a doubt the most exciting thing that's happened in the ozone world in my 25 years in it. In the world of medicine, it's going to become the gold standard of care for ozone therapy in the next decade among moral, ethical, and honorable medical people, professionals.
And for me, I don't mean to interrupt your train of thought. You've promoted DIV for years, and here you're actually coming and sort of surrendering and saying, hey, you've got something that probably even works better than DIV. Do I have that right?
I'll have it even better. It's not so much it works better, it works so much faster. So people will get well so much quicker. And that's the big issue. And in the process, there's less damage to veins. Now, I'm using DIV, and it works on any kind of vein, but it takes a very long time. Here, for all the patients with medium to large veins, I can get them well in ridiculous speed. And that's important for them, it's important for the world, and it's important for my practice. The patients that can't do the hyperbaric, well, that's where the IV comes in. And the two together make our practices and practices like ours the most powerful and important places to go to get well in the world.
Thank you. May I post this?
Yes, you may.
Thank you. Oh, one last question. Is it worth the money?
Is it worth the money? You have been undervaluing this, and if I can't get you to raise the fees, I'm going to charge you. It's ridiculously fair. Absolutely ridiculously fair. And I talk to the people and they talk to me. No one is unhappy that they came and that they had to pay a fee for it. It's the only way to get this quality and caliber of training. And more importantly, it's all honest and true. The truth is everything here.
Thank you very much. Today's February 8th, 2016. We're here with Gonzalo Mascara. He's a medical doctor. He attended my oxidation workshop, and you've agreed to, you've consented to me video you
Yes.
and post you, and
Yes.
so you can give your comments. What are your comments on our workshops?
Well, I'm very impressed the way the class is handled. Small groups, and you get direct access to the specifics of the machines. There is enough information on even physics of the ozone therapy, all the experience on treatments, and people that have experienced the treatments among the attendants, and good testimonies of patients. And the main thing is you can actually do the treatments yourself and get to it, make some errors, get corrections on the spot, and then you'll be able to next day implement your therapy wherever you're going. So I'm very pleased with the class, and I will recommend it to anybody.
Thank you. Is it worth the money?
Oh, absolutely. It was a trip. I flew 8 hours, so I'm happy I did.
You came from Miami.
Yes, I did.
So that is very nice.
Yes.
You flew 8 hours at cost and then to come here.
Absolutely.
Okay.
I'm pleased. I'm very pleased.
Thanks. And you'll be able to use this right away, correct?
Absolutely. Yes.
Thanks. Are you surprised? About anything? Did you have any surprises this time?
Well, this time about this specific technique we learned today, the
High dose ozone.
the high dose ozone is basically something very, very new, very intense, and besides that, great results. So I'm happy. I'm ready to
You're ready to do it.
get the bull by the horns and get
All
down
right.
to it.
Thank you very much.
You're welcome.
Well, one other thing. You just asked me to do a treatment on your shoulder, right?
Right.
And we shot ozone into a tendon, right?
Absolutely. Yes.
What happened?
Well, we did a few minutes ago. Immediately, I felt improvement, and now my shoulder is free. I don't have any pain.
No pain.
No pain at all.
And that's
Completely.
within about 2
Yep.
minutes.
Absolutely, yes.
Okay, thanks. Today's February 6, 2016. We're at my office, and I've just completed the first day of my very intense oxidation training. This is Dr. Alexander Haskell, who is from Salt Lake City. He's a doctor, an ND, and I just want to interview him on what he felt about today's session and what he saw and witnessed with his own eyes.
Mm-hmm. Yeah, it was a fantastic day, a full day, and I think what impressed me the most was certainly the variety of different techniques that we were taught, and also Dr. Rowan's patience and enthusiasm for what he does and his dedication to helping other physicians learn unselfishly Dr. Rowan's techniques, and talks a lot about different experiences and case studies, and very enthusiastically transmits some very important information. So very impressed and very pleased with Dr. Rowan's work and his education and his friendship.
Thank you. And what did you think about some of the cases we did with acute pain and what you saw, how their necks got better and backs?
Yeah, so, one thing I appreciate about the education is certainly reviewing a person's symptoms and looking at the physical sort of range of motion or the issues they're having, and then seeing how Dr. Rowan determines the different points of the ozone injections, and then afterwards goes through the same range of motion, same symptoms, and seeing improvement within a very short period of time, 15, 20 seconds improvement afterwards.
Were you surprised?
Well, I've been doing ozone injections for about 15 years, so I'm not
So you're not
surprised.
surprised. Okay,
But I appreciate it.
good. Thanks a lot. I may post this.
It's for sure.
Thank you very much.
Okay.
Ask me questions?
Well, today I'm interviewing people about the seminar we just completed. This is day one. This is Peter
Jovanovic.
Jovanovic, excuse me, who ran a Malaysia clinic doing continuous ozone reperfusion.
Recirculatory hemoperfusion.
Right. And so you've been an expert in ozone for a long, long time. For the viewer, what did you think of my session today?
I think you're just outstanding, man. I think you did a really good job. Everybody in here did a really good job. Training is incredible. Everybody should come and get training by you. And that's my honest opinion.
Thanks so much.
Seriously.
Can I post this?
Yes, you may post this.
Okay.
Not a problem.
And the interesting thing is, you know most everything that we were doing because you've been in the
Yes.
field a long time.
Yes.
But you saw
Well, there's a few tidbits that I learned, and Ozone is incredible. That I haven't seen before.
okay,
So, because we didn't do it in Malaysia,
right.
but the rest of it, you know, and I could teach you some stuff too.
I hope you will. Thank you, Peter.
You're welcome.
And this is Wayne Whiteman from Torrance, California, who's come up for a one-day training in February 2016. What are your thoughts on what you saw today?
Very interesting. I've been very intrigued with Ozone for quite a while. Actually, I see you at ACAM all the time where we both go. But I watched a video with you with David, what's his name, from David Asprey, and on Ozone. And I was very intrigued. But we're doing a lot in our office now. We have a lot of Lyme patients, so we're doing a lot of Ozone treatments.
Have you seen this method before?
Some of the things today, no. We do have the longevity machine.
Right.
But we're about to get the new machine.
Did you like what you saw?
It's fascinating, yeah.
Okay.
Yeah.
And you do Prolozone probably too, yes?
Not yet, but I'm very interested in it.
What were your thoughts on what you saw today with the results?
Well, I saw some of your YouTube videos, and actually it was right after ACAM and watching that video on YouTube, and soon after that I had some patients in with acute pain. And I was thinking you were south of San Francisco, so I told them they might want to drive up here and see you, because, or at least call your office to find out who was doing the procedures. But my background's in emergency medicine for 30 years, and I wanted to learn how to do some of these procedures, so today was very enlightening. And
will you be able to go back and do some of them now?
Absolutely.
Great.
Yeah.
Then I was successful.
Yes, you were.
Okay.
Yeah.
Would you recommend it to other docs?
Absolutely. It's fascinating.
Thank you so much. I may post this?
Yes.
Thanks. And we're here with Jacqueline Blakely, MD, naturopathic from San Francisco. And comments on what you saw today?
I thought it was really amazing training. I'm excited to be here and be able to learn this kind of medicine and be able to bring it back to my patients and help them with their chronic illnesses.
Would you recommend this to other docs?
Absolutely. Yeah.
Okay, let's talk about you for a moment. You had terrible back pain when you came in.
I did.
And we did your SI joints, and what happened to your leg strength?
It increased dramatically after the treatment.
Instantly,
Instantly,
right?
one treatment, instantly.
And in terms of your pain, you were able to get by the day without taking a Vicodin.
Correct.
And you're happy about that?
I'm very happy about that. My pain was probably about an 8 or 9 out of 10.
Okay, now you're going to be brave and we'll talk about a female issue.
Yes.
You want to tell the viewer what we treated you for?
Sometimes I get Charlie horses in my vagina upon orgasm, and I have difficulty with arousal, and so we injected my clitoral hood with Ozone.
And it didn't hurt much, did it?
Didn't hurt at all,
It was like
actually.
a piece of cake.
Piece of cake. The back hurt worse than the clitoral hood did. Yeah, for
Okay.
sure.
And I admitted to you this was the first time I had done that.
Yes, you
And
did.
what we're trying to do is improve your sexual function.
Correct. Yes.
And you'll just have to let me know.
We'll have to let you know.
I hope you'll come in with a big smile on your
I
face.
hope
like
I
that.
come too with a big smile on my
Okay.
face.
Thanks.
Thank
Can I
you.
post this?
You may post this.
Thank you.
Thank you.
This is Craig O'Donoghue. He's a dentist from Fairbanks, Alaska. Came a long way to see us. What were your thoughts on what you saw today?
It's amazing, really amazing.
Would you recommend this for other people?
Absolutely,
Dentists included.
absolutely. Yep.
Okay. Were you surprised at the kind of instant results you saw with the patients?
Not really. I've been reading up on it, so I was kind of
expected
expecting
it.
it. Yeah, I wanted to see it with my own eyes.
Thanks. Was it worth it to you to be here?
Absolutely, yeah, definitely,
Thanks. I may post this?
absolutely.
Thanks.